Welcome to session 6, everybody. Digital tools to support paediatric care with Sarah Crowe. Thank you to the sponsors for today's activities, and please make sure those of you that haven't see the sponsor stand outside. There will be time for a few questions at the end with Sarah, so please, if you're online, put them in chat, and in the room, maybe jot them down so you're ready. So let me introduce Sarah Crowe, previously a practice manager working in general practice and allied health. Sarah worked for Eastern Melbourne PHN in the GP redesign team and practice support team, improving and strengthening general practice workflows. Within this role, Sarah provided consulting on practice management, accreditation, chronic disease management models, government initiatives and best practice guidelines. Sarah now works at Western Victoria Primary Health Network, where she originally led the remote patient monitoring program and has since taken on the role of digital health manager for the organisation, writing a digital health strategy and supporting primary care to engage with digital health solutions. She's also a bit of a legend. Welcome, Sarah. Go to the next page.
Oh, good. I'll just let the health pathway sit there for a moment. Thank you. Thanks, Naomi. I'll move on. Oh, that's embarrassing. That's me. So today I'm going to do a bit of a demonstration on how some of the digital tools that we support might be useful in a paediatric care setting. So I've just defined exactly what I'm going to show you how to do today, which is using a program called Polar, which I'll explain shortly, to find those patients in your database that do not have a coded diagnosis recorded, and we'll talk about why that's important. I'm also going to show you how to use Polar to identify patients that might be due for a care plan, and also potentially going to show you, if I can get it to work, how you could use a tool called GoShare to share patient information with your patients via text or email, which is probably a form that I would say teenagers are probably more likely to engage with. There we go. All right, so as I talk through our digital tools today, I also want you to remember that I'm showing a specific example, but you could swap out a different cohort, you could swap out a different condition, you could swap out any situation. I'm just going to show you one example. So Polar is a data extraction and analytics tool that we offer to all general practices in Western Victoria. We offer the licence, we offer the training, and we also offer the support to use that tool. It's a population health planning tool. You can use it to do service planning, benchmarking, and any other quality improvement activities you might want to do. The whole idea of Polar is that it looks over your clinical software, it pulls out all the data within that software, anything that's in a field, and then you can use that to generate reports, which will all make more sense when I show you what it looks like shortly. So as I've listed here, practices can use it for data cleansing and quality improvement activities. You could use it to identify patient lists that might be eligible for something or might benefit from a certain care pathway. And identify best practice care opportunities. So before I jump into Polar, I thought I'd introduce this guy, Johnny. Johnny's a 17-year-old male who has type 1 diabetes. He lives in Horsham, but he could also live in Port Fairy. He could live in any other rural city we've got. And he currently travels to Ballarat or Melbourne for Royal Children's Hospital services. He lives with one parent at home, and what I want us to do, and I'm going to keep referring back to Johnny throughout the demonstration so you can think about how these exciting digital tools might actually have an impact on a patient. So the first activity I'm going to do is I'm going to open up this cool program called Polar, and I'm going to try and identify patients who are under 25 and don't have a coded diagnosis of diabetes recorded. Johnny's got diabetes, but it's not sitting on his file appropriately. If you're not sure what coded means, it means when you go into you go to record a diagnosis in the patient file, and you decide to free type instead of select from the drop-down box, likely it's not coded, which means that tools like Polar or any other digital tool can't read that diagnosis and include him on that registry. So it's really important that we do code diagnoses so that we can use digital tools, so that we can identify opportunities for routine care or health promotion, so he comes up on all those registries and lists. To ensure that other clinicians have a full health summary, if another doctor or another clinician is going to have a look at the information about Johnny, it's important that his diagnosis is recorded there, but also so to enable population health planning. So what I'm going to do now is actually open up Polar, and bear with me, it's always interesting when you want to use an online tool live. Might have to... How's that? That looks good. Okay, so this is, before I start, I am going to call out, this is dummy data, this is not real data, it's a test clinic. I believe it's called Chocolate Chip Clinic, if you see it, it's come up somewhere. And this is what general practices have access to. So if I go and have a look at my reports, Polar's a really powerful tool. It's got lots and lots of reports available, but I'm just going to show a basic, I'm going to navigate to the clinic summary. And you'll see it takes a second to load. May take a couple of more seconds in a clinic because it's actually pulling data from your entire clinical information system. There it goes. It's going slower than it usually does. It's because I'm presenting, I'm sure. All right, so this is the clinic summary dashboard that comes up for general practices. It's pretty cool. You can have a look at how many patients you've got in your database, how many of those patients are actually active. You can see it's got some really cool reports showing up here that's showing me how many patients have different risks for different categories. So whether that's the OSD risk, their likelihood of developing diabetes, the HARP, which is how likely is a patient to be admitted to hospital in the next 12 months using a series of different risk factors. It runs the CVD calculator across looking at people's cardiovascular disease risk. And there's also a new one added for liver cirrhosis. So I could click on any of those bars and actually identify who are the people who are at that high risk. It's telling me 1,328 patients are. I could go and generate a patient list and invite those patients in for a service, send some health promotion information, whatever it might be. But what I'll keep myself on track, which is I wanted to find out which of my patients who are likely to have type 1 diabetes do not have a coded diagnosis. So this is a quality improvement activity. It could be used for PIPQI. So the first thing I'm actually going to do is I only want to look at my active patients. That is, are they marked active or inactive in my best practice, medical director, ZMed. I'm then going to head to a report called the Clinical Indicators Report. This report's really cool, and I deliberately chose this to demo because you can generate a patient list based on inclusion filters and exclusion filters. So that is, they are under 25, they are taking insulin, but they do not have type 1 diabetes recorded on their file. So that's exactly what I'm going to do. I'm going to go and find all those patients that are under 25. I've selected all those age bands and I'll give it a green tick. You can see straight away my patient count closes and you can see my filters starting to collect up the top there. I'm also going to go across to medications. And I'm going to make an assumption that if they have been prescribed insulin, and you can see a number of different options come up there. Please bear in mind I'm not a clinician, but I'm going to go ahead and select all of those and go give it a green tick. So now I've asked for all my active patients who are in that age range that have been prescribed insulin. I'm then going to go to exclusion filters. And I'm going to show, I don't want to include those patients that already have a recorded diagnosis of diabetes. So I'm going to exclude those that already have that recorded. Lucky I did this because I've decided that Johnny was one of those kids that didn't have a recording. So now 3 patients I can see have come up that are on insulin but aren't recorded as having diabetes. I'm going to go patient list. Bear in mind this is a fake patient list. And I'm going to go into those files and I'm going to record diabetes to make sure they come up on our registries, they come up on our lists. So that's example 1. If you imagine though, you could use that clinical indicators list to do a whole lot of things. When I was in clinic, you know, a warning came out about a certain medication. I could use that report to go in and find who's been prescribed that medication in the last 12 months and send out a warning letter to those people saying you need to check or you need to take your asthma puffer back or whatever it might be. So that's a really cool report. The next thing I'm going to do is go in and find which of those patients that have diabetes, whether they have a care plan or not, an active care plan or not. Why is this important? Whilst a lot of kids get their care from the Royal Children's Hospital Services, which is fantastic because we certainly have shortages, it's also really important that these kids are building a relationship with their local GP. So, with their local GP, so that they can get to know the health system really well, because at some point they're not going to be able to access those services anymore. So if they're building a relationship with a local GP and they get to know their local services, it can ensure the patient understands how to work with their GP and manage their condition, particularly in a few years when Johnny turns 20 or whatever it is, whenever his eligibility runs out. And it's important that the GP themselves can have oversight and contribution to the condition and the management plan. So a bit like what we were hearing before with the Port Fairy Medical Clinic and from Anne, the importance of building a relationship with your local services and your GP so that when they become adults, they don't have to navigate that. They've already built that. So I'm going to go back into Polar. And clear all those filters. It's going to be nice and slow. There we go. Okay. Back to reports. Back to clinic summary. I need waiting music. Dun, 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 dun. There we go. Alrighty. So the first thing I'm going to do is go and find all my patients who have a diagnosis recorded. Now that we've cleaned up the data and that I know that all those kids do have a coded diagnosis of diabetes on their file, I'm going to go and select those patients. So I've gone to the diagnosis report. It's not showing up very well on my screen. There. So I'm going to select all those with a diabetes diagnosis recorded on their file. And go tick, give it a green tick. Also going to go and choose only people who are under 25. So you can select more than one and give it a green tick. Bearing in mind this is fake data, so I imagine there'd probably be more than 14 patients in most clinics. I'm now going to go to this really cool tracked MBS page. This is a report that shows you all the different eligibility for your patients based on the filters you've put on the top. Who's eligible for a GPMP or a TCA in item 721, 723? There's a few different things in this report. You can also have a look at medication reviews, who's eligible for GP mental health plans, Indigenous health assessments, other health assessments. There's a whole lot in here, heart health check, but I'm going to stick with GPMP because I want to make sure that all my patients under 25 who have diabetes type 1 or any diabetes have a GPMP with their doctor. And again, I think because it's usually on a different screen, it's showing up a bit funny. I'm just going to make a bit more room. All right, so as you can see from this report, there's 11 of those patients have something to action. You can decide to look at those who have never had a GPMP, those who have an expired GPMP, but I actually want to look at both. I want to get both those categories of patients. And there's 11 of them. Again, I think that'd probably be more in a real practice setting. Once again, I would go up to patient list. And I'd probably get a nurse, a chronic disease coordinator, or a receptionist even to call those patients and invite them in for a care plan. So once again, I've showed one example of this tool, but I want everyone to think about, there's a million different ways you could use those reports. There's lots of other reports available in Polar, but you can choose your filters, you can choose what sort of item, MBS items they might be eligible for, whatever it is that you might want to use. That first report I showed, the clinical indicators report, that's, I think, just so useful because you can choose all your inclusion and exclusion filters. And the final part of my presentation we're going to have a go is to use GoShare, another tool that Western Victoria Primary Health Network offer to general practices. So GoShare is a tool that you can use you can either bulk send or individually send via SMS or email different information, general information about health conditions. One of the strengths of this tool is that they do patient stories. So they've got videos, short videos that you can send to patients that are actually where they've interviewed people with lived experience or with the condition about their experience and their learnings and their advice, and you can send that to patients. I think this would be really useful when it comes to teenagers who probably don't want to get handed a pamphlet. I think about our doctors and secondary school programs where, they don't necessarily want to go back to class with a pamphlet that's going to fall out of their bag on the way or that other people are going to see. So if you can just very easily text information to their phone, that's much more preferable and you're more likely to have an impact. And I'm going to see if I can get this to work. Bear with me. See how we go. We've done a bit of work in the GoShare space, so you can use Polar to generate a list, let's say a list of all those kids that are eligible for a care plan, and then you could use GoShare, upload that list into the website and send all of those kids a video about why a GPMP might be important. What's going to happen? What is it about? So we've done a few different models in the doctors and secondary school programs. We also put together a package around how to be safe over the holiday season and how to go to parties and feel safe and have the right conversations. And we thought we got clinics to send that out over the summer holidays. So as the school was closing up, you could send out some information to them. The kids can forward that information to their friends, so we can't see that from a data perspective, but I do see a benefit in that, if they found something useful, they could share that with their peers. I don't think it's going to let me show I'll give it one more sec. Another model that we've done is using it to invite people in for whether it's a COVID vaccine, whether it's a flu vaccine, sending little content packages out about why it's important to get those things. We'll be doing one later in the year around cervical screening, so sending out some videos around and animations around why cervical screening is important, what the new process is for self-collection, and then being able to send that out to a whole, 200 patients in a couple of clicks, and seeing what impact that has on people booking in. We also had some success in the COVID vaccine space. We've currently got some content out there that we've created where there's a local leader from an Indigenous community or a First Nations community out Horsham Way. They've done a video on why it's important to get COVID vaccines, and clinics are sending that to their identified First Nations patients to encourage people to come in and get their COVID booster. Sorry guys. I was really excited to show GoShare because anyone can receive. Let's give it a go. This is hopeful. Excellent. So I'm going to log in. Clinics would have access the same way. They'd have a username and a password. Yes. Here we go. Okay. So this is what it looks like from a clinic perspective. Clinics can upload their branding into GoShare so that when the SMS information is received, it actually comes up with your clinic logo, so the patient can recognise, oh yeah, I attend that clinic, I know who this is from. And you've got all these different topics here, and we're continuously adding to this database. GoShare have a system where you can actually request to get any content added, and they will go and do the work for you. So if there are certain resources, online resources that you rely on and that you really like, have a chat to us so we can organise to get that uploaded into GoShare. But what I thought I might have a look at now is there's a whole tile on diabetes type 1 for young people. Okay, so you can see here under that topic at the moment, there's 18 videos. There's 8 patient stories, a whole lot of info sheets, and a whole lot of apps and tools. And I wonder if the sound works, because I'd love to show you what this actually looks like. I'll go here, see if the sound works.
When I was at school, I found everybody was pretty understanding of me having diabetes, and so when I first got diagnosed, my mum made sure that all the teachers and my principal, my nurse, knew that I had diabetes, so she wrote them all letters and stuff. And there was one time when I first got diagnosed, I went low and I went to have like a chocolate bar or something, or jelly beans, and my teacher got a bit annoyed at me because he's like, oh, you have to wait until lunchtime, like nobody else is allowed to eat. And I got a little bit upset because I was like, I've got to eat, I'm diabetic, my blood sugars are low. So he was like, oh yeah, sorry, I forgot. And so then like, the nurse came and she's like, no, everything's fine. She bought me jelly beans and made sure I was okay. So in future, she made me a card that just said that I could get out of class and go straight to first aid with no questions asked, so that there wouldn't be any problems like that in the future.
I think the students can like stop bugging me about like, why do I go out and why does she get to eat in class, or why is she drinking?
I've never experienced any stigma or bullying because of type 1 diabetes. I mean, it may be a passing comment in high school when you're in, year 8 and the boys are like 13 and 15, it's all they can come up with, but it's never really affected me. I haven't really been bullied because of it, which I'm glad. So everyone's pretty understanding.
When I tell people that I have diabetes, no one's ever been negative about it or I don't know, some people don't really know what to say, but I'm a pretty outgoing person myself, so it's pretty easy to explain it and then they're comfortable about it.
I think my nurse at my school actually ran a little mini course for all my teachers or all the teachers in the school, just to give them a rundown of what diabetes was.
All the teachers got the information I had to take in all these booklets and stuff to tell them how it was and what should they do if I was sick or if I had a hypo.
My friends were always really curious, asking questions about the condition, and my close friends knew, they knew if I needed to get sugar, I needed to get sugar and things like that. And most teachers understood. I think there was a photo of me up in the the school sick bay or in the staff room saying type 1 diabetes, what it is and things.
I'm just going to pause it there just in the interest of time, but you get the idea that the strength of using patient stories to teach kids around their own health condition, hearing from people that they can relate with. So there's a lot of this sort of content, these patient stories, and they're constantly getting created, with new projects coming up and new funding. So I'm just going to do a quick demo because I know we've only got a couple minutes left. So at any point, what I can do is add that to my bundle, and you'll see it adds up here, and I've already added a few other things. If I go up there, you can add info sheets, you could add videos. If I just go back up to these bundles, you can see the one that I've just created. You can also see a bunch that I've already saved, and Westvic PHN, our digital health team and our practice facilitation team can help clinics use any of these tools, use this tool. I've already created it there. Type 1 diabetes, young people. I've named it. It's got a video in there about why is a GP management plan important? What is it? What's going to happen and why is it important? And I've popped in that video we just saw part of around having type 1 diabetes and school life. So what I could do is easily send that bundle to a certain patient. I could change any of this text going, "It was great to see you today. Here is the video I was talking about." And you could actually put your own name as the nurse or the GP. So you can customise it. You can customise what comes up automatically as well. And you can just pop in people's details and send. I often ask everyone for their mobile numbers if you want to receive it, but I might not do that as we're streaming live and everyone will have your mobile number. But do get in contact with us at the digital health team. I'll just share our email address, but it is also on the flyer out the front, where you see all the Westvic PHN flyers. There's a digital health one there. These are just two of the tools we support. There's lots of things that we provide support on, whether it's secure messaging, using Polar, e-prescribing, e-requesting, anything in which digital tools are being enabling the delivery of healthcare. That's our space. We are not technology IT people. I'm certainly not a tech person, but I can help in how digital tools can help deliver healthcare better. Thank you.
Okay. Thank you, Sarah. Great presentation there and lots of things to take home with us. We do have time for a few questions for Sarah. If we have any from the room, we'll start there. And we've got roving Jenna today. So thank you. We've got one question here for you, Sarah.
Sarah, when are we going to X the facts?
There is currently a group of people coming together to start a working group across Western Victoria to talk about how we securely share information across Western Victoria and maybe even more broadly. So it is in the works. It's in our digital health strategy, which started this year. It's a 3-year strategy, and that's absolutely one of our priorities.
Thank you. I think we're going to... Any more in the room? No, we'll go to online.
Yeah, I've got a couple of online questions. Might be a stupid question, but how do we access Polar?
There are no stupid questions, especially in digital health. What I encourage you to do is reach out to your practice facilitator or email that digital health email address and we can set you up.
If we've already got it in the clinic, how would they access it if they're logging onto
It's
their
just via the
system?
web. It's a web-based tool. Again, you can reach out to us for training and support on how to use it, how to find it, how to save it.
What would be the cost of these programs to practices?
So in Western Victoria, we as a PHM will actually provide Polar to you at no cost, along with the training and support at no cost. And same for GoShare. If you're a clinic that is interested in using GoShare, we also provide that tool at no cost to our general practices.
Thank you. Thank you to our online participants. Oh, we've got one question. Hang on, wait for the mic. I've got strict instructions that the questions must wait for mics, so we'll do a little dance on this side as it comes across the room.
Thank you. Hi, how you going? That was good. I've just started using Polar, so it was good to hear.
Great.
But with the Walrus, I was trying to download that and there wasn't a log. Is there a certain different login that you have to log into Walrus, or?
It should be the same login, but it is per computer, per desktop.
Yeah.
So again, reach out to your practice facilitator or myself via
I was
that.
putting in the email that I used for Polar, but that wouldn't fit in the...
Your username's first name dot last name.
Okay.
Yes.
All right. Thank you.
Yeah, it's a little
Yeah, I'm just getting my head all
nuance
around
of
it all.
the
But
tool.
yeah, it's been great. Thank you.
Excellent.
Thank you.
One
There's
more online.
One more. Oh wait, we've got time for one more. That's fantastic.
Sarah, can you speak to the use of My Health Record in routine practice?
Oh, yes, I can. How much time do we have? No, I fully endorse and promote the use of My Health Record in general practices. I've got a few ideas of how you can integrate that into your workflow. One of the things that we did was make sure that at the end of every care plan, health assessment template, anything like that we used, there was a little prompt at the bottom to remind clinicians to do an upload to My Health Record. I'm really excited about the developments that are probably going to happen over the next few years, given the budget. I believe that we'll be spending the next couple of years engaging Allied Health to also use My Health Record. I'm pretty thrilled that they're going to be mandating the upload of pathology and radiology into My Health Record. So it's going to start becoming more and more useful. It's one of those tools that's not useful until everybody starts using it. I know a lot of family and friends that actually do access their own My Health Record, and I've heard lots of really good stories around people being on holidays or moving, and it's saving lives. There is a new My Health app out as well, so please head to our website to find information about that.
I'm getting a prompt that there's more questions. Everybody's happy to see Sarah.
There is. Hi, Sarah. Do you know how Polar compares to Cubico?
Yeah, I do, a little bit. I've had a demo of Cubico, but I've never used it before. Cubico, I believe, integrates with your appointment book system, which is a really exciting functionality, and does a lot of the things that Polar does. What I have heard recently is that there are developments underway at Polar to actually integrate with your appointment system as well, which would be a huge development, would be really exciting. So I would say watch this space. But yeah.
This is a comment. These look great resources that I didn't know existed. That's from a new fellow GP.
I will say, anyone looking for any of these resources, I did create walkthroughs for all of the demos that I did today. So I'm happy to share them somewhere after the conference. But if you head to Practice Connect, our general practice facing website, you can go to our website and find it via there. All these resources are there, and walkthroughs and education on how to use the tools.
We've got one last question.
Sarah, are there any digital projects in the process for providing info in waiting rooms, e.g. DIS in providing short visual info in infographics with QR codes for more information that could be on a monitor in a waiting room?
Not currently, but please get in contact with me because I'd love to have that conversation and think there's a lot we could do.